But of course, today, the 29th of January 2023, is the World Leprosy Day.
Love is really deeper than meets the surface.
Yeah, it's the World Leprosy Day, a day observed internationally every year on the last Sunday of January to increase the public awareness on leprosy as a disease, or Hansen's disease, as it's also known. The date was chosen by French humanitarian Raoul Fleurot as a tribute to the life of Mahatma Gandhi, who had compassion for people afflicted with leprosy. It's our duty to educate, inform, and entertain, and we are here to inform and educate you on World Leprosy Day. What does it entail? The disease, Hansen's disease, what is it all about? I have people with me here in the studio this afternoon to help me talk about this. They are more knowledgeable than I am about this particular thing, and they'll be helping me dissect it this afternoon. Hope you stay close to your radio and keep yourself informed. I have Dr. Ngozi Ekeke, a public health physician, medical advisor, German Leprosy and TB Relief Association, and also from Red Aid Nigeria. He's here with us this afternoon. Good afternoon, sir. Good to have you.
Thank you very much, listeners. My pleasure to have you this afternoon.
And also we have Stella Ugu, a person affected by leprosy, staff Red Aid Nigeria. Good afternoon. Good to have you here.
Good afternoon.
Welcome. All right, Dr. Ngozi Ekeke, today is World Leprosy Day. A lot of people do not understand that there is a day like this. I think the United Nations are pushing campaigns like this. World Health Organization also pushing such campaigns as this. World Leprosy Day every Sunday, last Sunday of January, is mapped out for this particular thing to raise awareness about this disease, Hansen's disease. Tell us about World Leprosy Day and about leprosy as a disease.
Oh, thank you very much. It's my pleasure, Yagaze, to really be with you in studio. And good afternoon, ladies and gentlemen out there. I think you've actually done justice to the introduction of what World Leprosy Day is all about, especially with respect to a day of creating awareness so that the general public would get to know about leprosy and so many things they should know about leprosy. And it's an important day to also celebrate persons affected by leprosy and discuss issues around their human rights and so many other things. So hopefully we'll be looking at what leprosy is all about. I know, how would we know about that? So that would be a lot of what we'll be looking at, and it's my pleasure to do so.
All right. And talking about what leprosy is all about, what causes leprosy? That's the question that many people will want to ask you this afternoon. How does one, contract leprosy as a disease? Is it something that is genetic? Is it something that is an infectious disease that people, contract? How does it come about?
Yeah, thank you very much. Let me start with what leprosy is not.
Okay. Fair enough.
Before I talk about what leprosy is and what causes leprosy. An average person on the street, if we ask the person about leprosy, the mind will go to some people who are beggars on the street somewhere there with their fingers chopped off. That is exactly what leprosy is not. And it's important that we get it clearly. And so leprosy again is not a curse, maybe from God, because we know a lot about Bible and leprosy. Somebody has this, should be wrong. That is what leprosy is not. Leprosy is not also hereditary. This is a very common thing that many people, including health workers, are ignorant about. So leprosy is not hereditary. And again, leprosy is not one deadly, infectious stuff. No, it is not. Okay. Now, what is leprosy? Leprosy is simply a disease that affects the skin. I don't want to use medical language here because there are many people listening. So let's leave the skin, that you see something on the body. And the person may not actually be aware of that. It can affect, the cold parts, of the body, and is actually caused by a bacterium called Mycobacterium, leprae. So it is a bacterial infection primarily that could be treated. But the one thing that's amazing about leprosy is that if you don't pick it early enough, it can cause irreversible damages. And maybe as an intro, I will tell you just something that is of interest. Yeah. We are in election period. A few days ago, I was like about a week ago or 2 weeks ago. I went from my house inside the Enugu here in Owan, just trekked to the Zik Avenue Primary School to pick up my PVC. Yeah. Of course, the crowd was there as usual. I wrote my name, and while I was there waiting for my turn, I saw a young man, about 28 years old, just walking in to pick the PVC for his boss, an apprentice. Just looking at him while he was coming in, I knew that was leprosy. I could stake my money for it. And eventually that was leprosy. And the hands, their feet was okay. There was just like things like pimple, nodules all over the face. I called him aside. I said, few things I mentioned about symptoms, which I will talk about very soon. Yeah. It was very clear. For the past 1 year, he's been in town looking for help everywhere. That's why a day like this is very important, so that people will get to understand very important things about leprosy. And Stella, who is a person affected, has an experience to actually share, that is life. So let me just stop there for now.
All right, let's get to the diagnosis part, because you already mentioned it. People, if you don't pick it up early, that's something you said. If you don't pick it up early enough, it could be damaging for maybe some organs in the body, I believe. How does one diagnose themselves? Like you said, you just looked at somebody and you could tell immediately that these are symptoms of leprosy, and you asked him further questions and confirmed that it was leprosy. So how does someone who doesn't have this knowledge like you do at least know when to get to the hospital for proper diagnosis? How does one tell that, okay, this could be leprosy, let's get something done quickly?
Yeah, thank you very much. This is a very important question, perhaps the most important I'm going to really anchor our discussion around, because still using that case scenario that happened less than 2 weeks ago right here in Enugu Urban. It's not even the first. I think we have a couple of examples that has happened. And let me explain it a way that somebody out there will be able. It's easy to recognize leprosy. Let me put it in simple terms. I don't want to use medical terms now. Yeah. Once somebody sees something like pimple on the face, around the face, and this pimple has been there for too long, and you are trying so many medication, it appears it's going and it's not really going. Okay. Please go and check. I mean, your hands, your fingers, your toes may be normal. And for example, the young man I'm talking about, I just asked him a few questions. He was shocked. He said that I just told him exactly what the matter is. And for your information, this guy had gone to a hospital in town here, and the doctor missed that diagnosis.
How come?
That is as serious as that. So that's why today is important that we do this awareness. So simply ask him 2 questions. Do you ever feel some stuffiness on your nose from time? He said, yes, exactly. That's what I feel. I said, okay. Do you from time to time when you blow your nose, you feel something, blood coming? He said, exactly. That I'm just describing that. And that was just enough to know that this is leprosy. So when somebody sees something like those nodules or something, say like big pimples all over the face that just came from nowhere, can't understand, and the thing is lingering for weeks, for months, please go and check. In all the 774 local government areas in Nigeria, there is a supervisor, a health supervisor for leprosy, who can actually give further information, examine further. So this is just one. Another thing that will make anybody know this is leprosy, when you see any patch on the skin, like the color of the skin, any part of the skin is not the usual, what some of us may call eczema or whatever. It may not really be eczema. If we're dealing with leprosy, the danger is that it can stay for a very long time. It's not itching you, it's not disturbing you, and it continues like that until after some years, the nerves are involved, and it would cause damages that would not be reversed. So anything on the skin that look like a patch, different, lighter in color, any part, no matter how small it is, please suspect leprosy and have it handled immediately. So when you see that any nearest local government close to you, Enugu North, Enugu South, or any of us, just get in touch. There is somebody who have trained to be able to look at it closely and tell you really is leprosy, and the treatment is available and it's also free.
It's free.
Sure, it's free.
Okay. So the World Leprosy Day campaign, WHO has this campaign out there to inform people of these symptoms, and you're now saying that the treatments are actually free, so people do not have to be afraid of, exorbitant hospital bills that they have to pay for it.
Sure.
All right. And
both the diagnosis,
okay,
the laboratory test is free. The treatment, the medication, every part of it is free of charge.
Now you've talked about the treatment, because I was going to ask if it's curable, because like you said earlier, there is the stigma about leprosy, and people who have leprosy. There is that, maybe it's the depiction that we've seen in movies or something, people with hands chopped off and all of that. That's the kind of mental picture that most common people have of the disease of leprosy. So maybe you can tell us about these myths that we have concerning leprosy that isn't true, so that we can, dissect them. I know you talked about some of them, but maybe elaborate on it.
Yeah, thank you very much. At some point, I know that Stella will have to bring her experience rather.
All right.
Now, let me just clear this myth that people would with their fingers chopped off. I insist that is not leprosy, but that is complication that resulted from not coming for treatment early enough. Like the young man I met, in Uwani, assuming that nobody met him, in the next 2 years, the fingers will begin to chop off. And it is avoidable because the nerves are involved. The bacteria,
it's going to take like 2 years before it gets to that level where
it can actually take up to 10 years. It has an incubation period of 3 to 20 whole years, an average of 5 years, and it's not painful. Doesn't cause until gradually you begin to see. So it's like talking about some of the signs I just mentioned, that of pimple, large nodules, lack of skin patch. Another subtle thing that somebody suddenly realizes that he goes to bring down something on the fire and cannot feel the heat. He cannot feel that again. Or matches, goes into the farm or gets somewhere, something chokes the person and blood's coming out on the sole of the feet and the person is not feeling it. Excuse me. The person may have had the bacteria that is doing damages long enough and should have come for evaluation and treatment before it gets too late. Otherwise, it might become dangerously late and we have what we imagine to be leprosy, which will have all those people with wounds on their hands, their feet, and all of that. So another thing, somebody just said that, like a man I met some time ago, a patient, he said, look, suddenly he uses cutlass. He said, I'm holding the cutlass and I can't really grip it very well. Another man said somewhere, I carry keg, this 20 liter keg of whatever. He said, I'm just holding it. It's weak on my hands. That could be a symptom of leprosy. So leprosy is not really what we usually think. That's just very important that we know that. Many people are carrying leprosy, I can assure you, within town here, going around. And if they don't do anything about it, that's what we're talking about, act now. End leprosy. If you don't do anything about it, the damage will happen very, very soon. That's just the picture.
All right, let's get in Mrs. Stella Ugu with us now. Mrs. Stella, good to have you here. You have experienced this. Tell us about your own experience. How did you get diagnosed with this? And how did you get to know that you had leprosy? And how did you go about treating yourself?
Well, when the thing started,
when
the thing started, it started like pinching.
Pinching?
Yes. It started like pinching, moving around all the body, as if ant is choking somebody. And even started as if the feet is more sensible. If your feet is more sensible. Then along the line, it comes to be that the feet now become weak to hold even slippers. When you might be going on the way and you see that your slippers has taken off your seat, but you couldn't realize that. Yes.
Wow.
Then your fingers will not be holding something. Though I don't know about that, about it before. But along the line, I realized that I have something wrong in my life. Then I have to be going around till I go to that health center. They tell me, even I went to Oji River, met a Dr. Oji. Then he tested me and said it is not leprosy, but I insisted. Say, what is happening to me? Then along the line, I come back and say, look, treat this thing. Am I the first one that are suffering leprosy? Leprosy has been named before I was born. Yeah. So let me go into it very well so that I will treat myself early enough. Then, and along that line, I see that as I was treating it, it become like if it is worsening.
Okay.
But I insisted and take the drug for complete 1 year. Oh. Then I have to forget about it and be moving other ways to get myself.
You started getting relief maybe after 1 year?
Yes. Wow. So along the line, of course, I have that finger eat up something, yes. Yeah. So my fingers were eating up. But along the line, I become...
You got treated?
Treated.
Wow. Yes. It's not an easy experience at all from her own narration now. And it's because she was bold enough to go ahead and say, I have to get to the root of this. I have to get to know whether this is leprosy and get treated. And, the long run of the treatments, 1 whole year. I can imagine how much it would be for somebody who has to go to the hospital and pay the bills, and now it's free. Who is making it free and available for people here, the drugs in Nigeria?
Yeah, actually, the World Health Organization is making the medicines available through some other donors like Novartis and some other partners, making sure that the quality assured medication is available all over the world. It's not just for Nigeria, but then we receive that through the Federal Ministry of Health, and then it's available in all the states and actually all the local governments. It's available. Like she said, most of the cases are treated for not less than 1 year. And it's a simple medication. You just take, daily and continue that way, and the examination, and the germ is actually, over in the body. But if there are some deformities, the issue is that because there are nerve damages, it may not really easily get reversed. But I can tell you that there are so many patients we have here, some students, in some tertiary institution, I don't want to mention names, who we met with leprosy. If you see them on the street, you will never know. But we are happy about such cases because they were found early enough. They just observed, just like Stella said, they just observed that something was wrong somewhere, and they decided to come to care. And then the damaging thing is that, like, she was resilient to say, look, something is wrong with me. That is very important, that even if you realize that where maybe you go to a hospital, a private hospital, a public hospital, and maybe you met a doctor, you met a nurse, a pharmacist, giving you medication, and you don't seem to have a good, response, it's important that you seek help where, you can, especially go to the local government headquarters, ask for tuberculosis and leprosy supervisor, and you will be helped. You'll be given all the information.
All right. I would like to ask this question. Is there a demographic of people, maybe age-wise, that are susceptible to leprosy, particularly young people, older people? What group of people are more susceptible to leprosy?
Yeah, thank you. That's an important question. Actually, it affects both men and women. It affects both men and women, and it also affects all ages. However, it's rare to find it in very young children. Okay. The reason is obvious, because the incubation period is quite, long. Yeah, average of 5 years. So, but it can be as early as 3 years. So, because it takes time, but even if a child picks it at year 1, it would happen that it's going to take all this time in there. But I've seen children, I've managed a child 4 years with leprosy, with skin patches, started the medication, even before the child completed, all the stuff disappeared and the child was completely cured. So we have 12 years, 4 years and all of that.
And what organs does leprosy affect? We know we've talked about the skin. Are there any other organs particularly that leprosy does affect when one gets infected?
Yeah, it's very important that we also mention that as we speak, the nerves are the most delicate organs that are worst hit by leprosy. If you have met somebody who has stroke, you know, it's a difficult thing to manage.
Yes.
So usually the bacteria would affect the skin, the mucous membrane, the eyes also. Leprosy can cause blindness.
Wow.
Sure, leprosy can cause blindness. And then the nerves. Because somebody who has leprosy, you may not be able to blink properly. So when death entered from there, you know, it gets some complicated. And then, like, so when you hear about weakness, somebody is not able to hold something, somebody match it, like Stella was saying, you haven't seen past where, and along the line, it falls off your feet.
Yeah.
Don't even know it because the nerves, you know, the sensation has been lost on the feet or palms of the hand or even the eyes. So the nerves are real. That's why you see most of the complications that result, that make people now say, why is this person looking horrible? And people want to avoid that person.
Yeah.
But the good news is that it takes time before it causes those damages. And if we pick, in fact, like the team said, act now. It's important that every stakeholder, wherever the person is, if you're a school teacher, if you're a religious leader, if you're a community leader, if you're an association, even in the family, you should be able to check people around you. So that anybody with a patch on the skin or with something like a nodule, a pimple, or having these things we're talking about, should actually raise some flag so that this thing can be handled early enough.
All right, let's talk about the stigma because it's really important in our society. We know that stigma is a thing. Many campaigns against certain diseases. We've talked about stigma being one of the major issues that brings people down, people who are suffering from certain diseases that are actually curable, but the stigma in the society might make things worse for them. Let's get back to you, Stella. Tell us about your experience. Did people start avoiding you when you discovered that you had leprosy? Did people embrace it? And since you got cured of leprosy, have you gone back to your normal life, your work, and everything?
I got back to my normal work, but when it was happening to me, I was a teacher then, and I was avoided to be teaching in the classroom because of one of my finger, which I am running about to go and treat, and I go and take excuse from that school, say, let me go and find out what is happening to me. Then as I went there, so they have to serve me their own paper as for me to go and treat myself. And after treating myself, I come back again and say, look at what I have found about this thing.
Yeah.
So they have to just like that drive me out of that school. I did not be teaching that school. But now, but along the line, I find another place to be teaching and doing every other thing I can do in order to sustain my life. I
understand you're now working with Red Aid Nigeria, pushing this kind of campaigns, going about radio station, educating people about this particular disease, which is a great thing to do and really calls for a lot of strength from within you to survive this and come out and then help people get knowledgeable about this. I must commend you. Well done.
Thank you.
All right. Let's get back to Dr. Ngozi. I'm reading here that about 200,000 people are infected with leprosy globally every year, and Nigeria records about 1,000 new cases annually. Tell us about the predominance of leprosy in Nigeria, what the numbers look like.
Thank you very much, Agaze. You see, if you also look at that literature closely, you would hear that COVID-19 had affected the health system in such a manner that most of the patients could not be reached and could not be served. So, and the figure appears to be going down falsely. Now, in Nigeria, some years ago, you have 4,000 cases, new cases every year. I a point it was 3,000, and now it appears as if it's about a neighborhood of 1,000 to 2,000 cases every year in Nigeria for now. But with that should be handled with a lot of caution, because there are beyond diagnosis, because we carried out a study to discover that about 6 out of 10 doctors would not recognize leprosy if they see one.
That's serious.
So you can then imagine that we are talking about the very few that are lucky, globally. I've met very senior doctors asking me, is there still leprosy in Nigeria? They don't know anything about leprosy. Okay, so with the level of ignorance, not among the general public, I'm talking about healthcare workers, for which we've been doing a lot of trainings and campaigns with people living around us, here in Enugu and everywhere. So with that level of ignorance, coupled with the fact that even the patients themselves, if they feel that this could be leprosy, the stigma may make them not to even step out. Okay, so look at that. You cover that we have backlog of people. If we get all the persons who actually have leprosy, perhaps we'll be doing with 3 times or 4 times the number we are talking about. And that is actually, it calls for a worry, because these persons are there for years. Just in the neighboring states here, I was just in the health center, and I met a woman who had a baby, came for immunization. And I saw something. I said, look, that woman over there, can somebody call her? When she came close, I said, madam, this thing, how long has it been? Say for the past 10 years, she's been looking for solution. She can't find a solution. Obviously, it was leprosy. The diagnosis I made right there. And she started treatment and she's okay. But now the point is, she's been there all through with health workers, delivered her baby and all of that. So that will give you a picture that there are more patients in the society than what is reported. And they don't either they don't know about that this is leprosy, or the doctor out there, the nurse out there, the pattern medicine vendor that is giving them skin medication don't also know. And even the media may not also be so much aware that we are all, and anybody can be affected. So that is how important it is. So when we talk about the figures, we should bear in mind that there are more cases probably out there than what we have reported for obvious reasons.
It's World Leprosy Day, and we are here pushing for more awareness about the disease called leprosy, Hansen's disease. If you're a survivor or you know someone who has survived it, you can call us and tell us your experience with leprosy and how you managed it. 080-99-945-945 and 09128-945-945. Dr. Ngozi, I don't know if you would want to comment on what the caller just mentioned. A course set up by the Anambra State government. Are there courses for like this for medical practitioners who need to be more knowledgeable about the disease?
Yeah, I think I would like to appreciate Mr. Austin, if I got his name correctly, for that comment. With respect to training of healthcare workers, our organization had been here for over 50 years, and a major contribution in our partnership with the National Tuberculosis and Leprosy Control Program of the Federal Ministry of Health and various states. We cover, especially in the south here, southeast, southwest largely. Some states in southwest would be to train. We've trained quite a number of health workers on leprosy. And recently, when we made that observation about doctors, 6 of them not being able to recognize leprosy, we took action. So it's not just about nurses or those trained in the School of Health Technology. We've gone beyond that. As we speak now, the organization supports or funds medical students in the University of Nigeria. We've done that for ESUT here, Enugu State University of Technology, doing that for Ebonyi State University, for Abia State University, moving them to leprosy referral hospitals close to them so that they can have a feel as part of their training what, leprosy looks like, so that they wouldn't miss the diagnosis when they come across that. So we've been doing that in different batches of students. But recently, what we even did for medical students, because we are starting with medical students, was extend to other healthcare students to fly this small grant, research grant. They do their research to get a first degree. So we started that stuff to say, okay, if you want to research on leprosy, just as an intensive, we'll have a little money we'll give to you and then train you, give you materials. So all of these efforts is to build capacity so that the people that will be training us tomorrow. But the major issue is that compared to tuberculosis, HIV, malaria, that have global fund with a lot of money, we have very few persons and international funding agencies for leprosy. So the attention is quite minimal. Okay. And to wasn't the case, some time ago, World Health Organization came up with what they call elimination criteria and said Nigeria is one of the countries that have one case in 10,000 persons. And that means it's now come to a level, it's no longer a problem. And that was not really very helpful. In fact, they're trying to really take that back now because many people now withdrew. The leprosy is no longer a problem. Yeah. Whereas we are sitting on the, on a sort of disaster. Yeah. That's the picture here.
Wow. A lot that has to be done. Getting funding. Maybe the government should get more involved in getting funding for this campaign that you are pushing together with German Leprosy and TB Relief Association. Must commend you guys for the great work that you're doing. Anyways, we have to round off the conversation now. Some people might have joined us midway, so let's get them up to speed. What we are talking about today, leprosy, and what the World Health Organization is commemorating on this day, the last Sunday of January. Dr. Ngozi. Yeah, you can talk to our listeners who just joined what we are talking about. Just bring them up to speed as we round off.
Oh, thank you very much. And we want to appreciate all our listeners. Today, that is World Leprosy Day of 2023. We have a theme globally that is saying Act Now. End leprosy. And it's about creating awareness so that the general public would be aware that leprosy is still a problem with us here. It's like the big elephant in the house. And we are not even seeing that. And we have quite a number of cases that are very much in the urban area, in the rural areas, and we are not waiting for people to have their fingers or their toes chopped off before we say this is leprosy. Yeah. Because most of the patients, they don't have these things. And if we wait for that, it will be too late to act. So, and we've also I made it very clear that leprosy is not a curse from any god and is a bacterial infection. The bacteria can be identified under a microscope and the medications are free of charge, and with that the person can be cured of leprosy and the bacteria is out of the person's system. The person is free, really. And leprosy nobody should be stigmatized. It's actually out of ignorance. People are afraid because of the wrong, the misconceptions we have around leprosy, that is highly infectious, is hereditary. We ask some people, say, would you like your friend who's going to marry a lady that was once treated with leprosy? They say, no, nothing like that. It's out of fear and out of ignorance, and our job here in World Leprosy Day is to enlighten the general public. Excuse me, leprosy is not highly infectious as we feared. It is not. And it is not hereditary. A simple bacterial infection that is actually treatable. But then the major issue that if it is not detected early enough, that's when you see the deformities. The deformities that are irreversible, that make people look horrible. And you wouldn't want to really have them very close. And you see their mental health, they are affected badly. So we are telling the general public, please, if you see anything on your skin, it could be like nodules or pimples on the face that is one special pimple that is not the usual pimple. Yeah. This could be leprosy. If you see a color of your skin changing, it may not be eczema, it could be leprosy. And if you see that, look, you're just walking on the road and you can't feel, something choking you on your feet, or you're able to touch hot things and you are not feeling it, it could be leprosy. Or you are maybe trying to hold some things and your hand is weak or something like that. This can also be leprosy, like early signs. And if we come on time, you are treated, the person is actually okay. And treatment is available in all the 774 local government areas in Nigeria.
All right. Let's get Mrs. Stella Ogu. Just final words from you. What do you have to tell people who are scared, who don't know much about leprosy, or who have a misconception about what leprosy is? What do you have to tell them finally?
I'm telling them that leprosy is not a bacteria that it cannot be treated.
Okay.
And after treating, then you can get yourself as normal as every other person, as normal as you are before.
Okay.
You can walk in anywhere. You can walk, because when my own was online, then if I wanted to write something, I will use my shoulder to write, because the hand is not where be holding the beak. But now I'm okay from all those things.
Oh.
Thank you.
All right, thank you. Congratulations to you. Really
bless you.
proud of you. You're a survival. All right.
Yeah, one more thing I want to plead with the general public. Please, never again should anybody use the word leper for anyone. You know, it is under United Nations Human Rights Convention.
Okay.
Don't use leper. Somebody who has leprosy is either a leprosy patient, but if he's treated, he's free. You want to refer to the person, you say a person affected by leprosy. But never use the term leper, and don't stigmatize, don't isolate, don't avoid anybody who has leprosy. There's no need for that. Thank you.
Thank you so much, Dr. Ngozi Ekeke. He is a public health physician, medical advisor, German Leprosy and TB Relief Association, and Red Aid Nigeria. And also Stella Ugu, person affected by leprosy, staff of Red Aid Nigeria. They came through this Sunday afternoon to inform us about the commemoration of World Leprosy Day, which is something that happens every last Sunday of the year. Every last Sunday of the month of January. And, of course, this is the last Sunday of the month of January 2023. We hope that you learnt a thing or two from what they've talked about this afternoon. The treatment for leprosy is free across all the 774 local governments of Nigeria. Just walk into the local government, ask questions about who you can speak to concerning maybe the symptoms that you're having. These symptoms that they've mentioned this afternoon, if you're having any of them, or you know someone who might just be having these symptoms, get them to go there and get tested. It just could be leprosy, and if it's caught on time, definitely the treatment would be shorter. We've learned of treatments that have lasted more than 1 year. So if you go on time, maybe you can save yourself from more harm. Thank you so much for listening to